21-year-old female with thin hair on top of my head since I was 16. Met with a dermatologist in high school. She put me on spironolactone, Rogaine, hair laser, biotin. Some worked for a little bit, but then plateaued. I don't notice a hairbrush full of hair or hair falling out ever. Last couple months, I have had moderate acne and notice a little bit on my scalp too. I never had an issue with acne before, especially not on my scalp. I don't have any other symptoms. My hair underneath has always stayed the same. It's just on top that is so bad. I'm meeting with another dermatologist soon, but looking for ideas now.
Thank you for your question. You submitted your question with several photos, and you state in your question that you're 21 years old, you have been experiencing hair thinning since high school and somewhere around age 16, and that you've seen a dermatologist, and that you have received treatment which included spironolactone, hair laser therapy, biotin, and essentially you have seen some improvement and a relative plateau. And you're concerned, of course, about the degree of hair loss you've experienced on the top of the scalp, and you're seeing another dermatologist and you're looking for some additional guidance as to what to do. Well, I can certainly share with you our experience with a relatively small group of patients who do fall into your category that have become certainly much more aware over the course of time. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed using acellular matrix and platelet-rich plasma to help treat androgenetic alopecia, or male and female pattern hair loss, mostly genetic pattern loss, as well as other conditions. I can certainly appreciate the challenges that you are facing, and I think that when we started developing hair regeneration about 7-8 years ago, this was developed after seeing some side effects that occurred that were positive when we were doing hair transplant. Essentially, we were using a material called acellular matrix with platelet-rich plasma, and we found that thinning hair became thicker in certain patients about a year later after hair transplant. Well, we started working on developing processes to use it as a way to treat hair loss in both men and women. And I can tell you, for female pattern hair loss, moving the clock forward and now having a lot of experience, it's been a significant benefit to helping our patients manage hair loss. And I think it's important to at least understand that if your diagnosis, which I am sure your dermatologist already established either clinically or by biopsy, that if you have what's called androgenetic alopecia, then it is a genetic issue. We've treated a patient as young as 16, and when I heard about her in the hallway on my way to the exam room, I was already prepared to have her go through extensive workup in terms of endocrine and hormone, as well as biopsies, etc. But her mother was accompanying her, had exactly the same genetic condition. She actually had androgenetic alopecia with an onset at an early age. The point is that we have clearly, outside of the female pattern hair loss patients, which typically is more of a middle-aged woman, 45 and older, experiencing diffuse thinning, often associated with and somewhat related to changes in the estrogen-testosterone ratio. We've also identified a significant group of younger women as young as your age, as well as into their mid to late 20s and into their 30s, who also have androgenetic alopecia. And when I first started seeing patients like this, I always wondered whether I was going to miss anything, so I would do biopsies of the scalp to see what's going on and to rule out an autoimmune condition, an inflammatory condition, or scarring condition. So the challenge that's in front of you is really managing of a hair loss progression, which I think is somewhat not consistently predictable, and that what is essentially the goal is to maximize coverage for as long as possible. I think it's important to always have good medical management. Includes seeing additional dermatologists if appropriate to at least confirm diagnoses, checking hormone levels, as well as any other systemic potential contributors to hair loss. The spironolactone that you were placed on was to treat as an anti-androgen or to deal with possibly the contribution of testosterone to your progression of hair loss. We have performed hair regeneration treatment, which is an injection treatment over typically 2 sessions separated by 15 to 18 months apart, and watched our patients have improvement being defined by reactivation of growth of hair follicles that are currently not growing, which is essentially almost by definition a characteristic of androgenetic alopecia, where the hair growth cycles that are the active growing phase get shorter and the resting phases get longer. In addition to reactivation of hair, which then adds to the numbers, the thinning hair also gets thicker. And so in addition, it's been also established scientifically that the growth cycle gets longer, so the hair stays on the scalp longer. We treat these patients with great care because it is difficult to predict, and it represents such a small percentage of hair loss patients who have essentially what is typically, in terms of gender, more of a middle-aged and later age category. Nonetheless, we have found benefit to the application of hair regeneration to help these patients. A lot of times people who have this type of condition have such significant hair loss that they still end up wearing wigs and other things to try to have the appearance that is more socially appropriate for their age. Nonetheless, I think that you are clearly on a good path of getting more information, and you really need to have this team approach. I think it's worthwhile exploring the use of platelet-rich plasma, acellular matrix, to help you manage this condition. And as I tell all our patients with male or female pattern hair losses, this is something that's hardwired in the DNA, and there is an inevitable progression. However, medical management is to try to delay that progression and prolong the coverage of the scalp to be optimized for as long as is possible. So I think that it's important that you have this discussion. Hopefully, further research about PRP, acellular matrix, will be of value for you, and of course continue your pursuit of finding the optimal medical and as well as hair-specific treatments to optimize your hair growth. So I hope that was helpful. I wish you the best of luck. Thank you for your question.